This is ultrasound study of primary gravida, 2 months amenorrhea, history of amenorrhea, and positive pregnancy test, marriage. And this is a longitudinal view of the uterus in front of you. Sorry, this is not required at present. Now you see this is the uterus measuring 8.3 centimeter by approximately 8.3 by 3.14 centimeters. Okay, and you see there is now this is this is the urinary bladder in longitudinal section. This is the endometrial canal. This is the cervix, vagina, and this here you are seeing fluid in the pelvic cavity that extends into the, and now as this is the transverse section of the uterus. This is the endometrial canal. See, this is the uterus in transverse section, and this area marks the endometrial canal, which is clear of any gestational sac, clot, nothing. And when I move the probe that towards the right side of the patient, angle it upwards, adjacent to the uterus, I see tubular structure, this area, with numerous mixed echoes within it. This is the area. Now, this area, this is the uterus, and from the right corner of the uterus, it extends into the right adnexa. Is the dilated fallopian tube measuring 5.1 into 5.16 centimeter into 3.18 centimeter, with this being the urinary bladder, uterus in transverse section. And now the further study shows that now I will show you its relation, why it's tubo-ovarian, as when I move the probe transversely, I'm going to apply the Doppler. And what we see is the iliac vessels. These are the iliac vessels. This one, the artery, the vein, and note the close proximity of the mass, this mass. Now let's see if there is any flow or blood vessels within this within this tubular structure. Well, as such, there is no evidence of any. There are vessels, yes. Here you see twinkling vessels within this tubular structure. Now this is bleed or ruptured ectopic sac. this is the sac. If you can see, this is the sac, and there is no flicker or anything else seen within it, no blood flow, and we do see some flow within this cystic area, the tubular area, with multiple these ecogenic areas within it, along with cystic areas interspread within the. Now the thing is, we see cystic areas interspread within ecogenic areas. Complex tubo-ovarian mass of now this is the artery, iliac artery, iliac vessel. So the box is large for the scan, but just to show you, this is the artery running posterior inferior to this tubular structure, and this is the vein. If you see the mark, the red one is centripetal, and the blue centrifugal flow. To study now this is a typical venous flow pattern, and the arterial. Let's see this. I am also a beginner in this Doppler study, so don't mind my hand movements. Anyone who is expert in Doppler will easily conclude the waveform, the noise by itself. So this is venous, and see when it comes to arterial, the change in noise is different. So, sure. Okay, now this is in fact what we are studying. This is the sac. This is the gestational sac. Here it is. This is the gestational sac within the right fallopian tube, and this is the dilated fallopian tube up to now. The sac measures, here it is, the sac measures 14.8 into 21.1 millimeter, whereas this dilated fallopian tube with a lot of debris within it measures 6.22 centimeters by 3.2 centimeters. And so this is, let's label it. This is a sac. No, we should not write sac. I should rather write gestational sac. Keeping in view the history and the lab profile, this is the dilated tubo-ovarian mass. This is the urinary bladder. Okay, and rest all of this that you are seeing is the debris within the, or bleed within this dilated fallopian tube, this being the gestational sac. Moving, let me apply a bit of a gel, and moving forward, if this is an ectopic pregnancy, is it rupturing? No, not. Let's see. Now this is the, I am going to scan the abdomen to see if there is any fluid in the peritoneal cavity, and you can see that this is fluid in the Morrison's pouch. Let me take a better view. This is the kidney in transverse section, part of the liver, gallbladder, and this is the fluid in this region, in the Morrison's pouch. Now as I come downwards, this is the fluid in the right paracolic gutter, this area. This is the fluid in the right paracolic gutter. This is the iliopsoas muscle. These are the bowels floating in it, and we are on the right side. And as here comes the basic pathology. This is the dilated tubo-ovarian mass with bleed, and this is the uterus. Now I'm going to move towards the left side. Do we see any fluid or bleed in this region? Here we are. Now this is the left paracolic gutter, and you can see fluid within it. With this is the fluid. See the bowels within it. The movement of the bowel, the gas shadows, dirty gas shadows, and this is the fluid in the left paracolic gutter. So it has ruptured. There you see fluid in the pelvic cavity as well. So this is in fact our case of the day relating to ruptured ectopic pregnancy. Thank you very much.